Hello, everyone. Thank you so much for joining. Um, we will go ahead and start doing some introductory stuff as people join in, and we work to launch the presentation. So, with that, I'm going to go ahead and share screen. Oops. Okay, awesome. Can everybody see the presentation here? I just
Yes.
muted. Okay, cool, awesome. Okay, so um, for today's workshop, we have the topic of extreme heat. The title of today's workshop is Impacts on Communities, Healthcare, and Planning for Mental Health and Wellness Resilience Infrastructure in Oregon. It's a little lengthy title, but I think it also kind of encompasses the spirit of collaboration and also brainstorming and having this as a platform to launch um, some of the important work that we're doing. Um, so a little bit about what we're going to do today is, well, before I begin with the agenda, actually, um, for an icebreaker question, I do want to begin with an icebreaker question and an introduction. So as you're all coming into the chat or into the Zoom room, feel free to drop in your name, pronouns, as well as organizational affiliation. And the icebreaker question for today um, is uh, what is health resilience mean to you? What does health resilience mean to you? I'm going to stop sharing really quickly. Yeah, what does health resilience to heat mean to you? So I'm going to go ahead and drop that in the chat. Awesome. So for people coming in, chat the question is, or the icebreaker sort of prompt is names, pronouns, organization, and what is health resilience to heat mean to you? Mhm. Okay. Um, so moving forward, today we're going to talk about extreme heat and health resilience. We have a couple of guest speakers lined up to talk about their areas of advocacy. Um, we're thinking with the rate of heat related deaths increasing to 70% from 2008 to 2018, and Oregon experiencing one of the deadliest heat waves. Um, Amidst the COVID-19 pandemic, it's time we talk about equitable outcomes for communities and their health. Um, Given that disasters are continuing to be exacerbated by climate change and that there's acute impacts on communities and there's also this is as good a time as any to talk about building health resilience. So speakers are going to share their experiences in advocacy and promoting infrastructure for health resilience. And they'll talk about things such as shade equity and disaster resilience hubs and some of the work that they've been working on um, in the last couple of years. So uh, some of the guest speakers, I'll introduce them more in depth as we go through the presentation, but one of them is Dr. Vivek Shandas, who's going to talk about extreme heat and shade equity. Dr. Richard Bruno, who's going to talk about mental health and wellness resilience, as well as Alessandra de la Torre, who's going to talk about Southern Oregon work and disaster resilience hubs. Then after that, we're going to do a little bit of a Q&A with some of the panelists and move on to a couple of activities where we're going to ask from the audience as well, and people who I know there's a range of expertise and knowledge in this room. So let's define resilience. What does resilience mean? And let's do some mapping of resilience resources through an asset map in your community. So Some of the things that I hope would come out of this presentation is an understanding of resilience work, as well, and work that people have been doing in organizations on the ground, as well as a platform for us to continue to move the conversation forward when it comes to health and mental wellness resilience. That being said, this is part of a larger series for Oregon Physicians for Social Responsibility. We're hosting a couple of other workshops following this one. The next one is on the Cascadia Subduction Zone earthquake and the Critical Energy Infrastructure Hub in Portland, as well as in August, moving into wildfires and equity. September, we're going to delve into pandemics and climate change. And then we're going to close out our series by talking about some of the funding opportunities on the federal level for CBOs doing resilience and health work. And I also want to put in a quick plug for our other workshop that is not part of this series, but is specifically for health professionals looking to do advocacy work in mental health and wellness resilience. And this one's happening on July 11th. It is through a partnership with the International Transformational Resilience Coalition. And we'll be talking about some of the national level resilience and health work, as well as ways in which we can use a public health approach to look into questions of mental wellness and resilience infrastructure. And I'll go ahead and drop some of that information too as the speakers begin in just a moment. But without further ado, I want to also shift into introducing our first speaker for today's workshop, who is Dr. Vivek Shandas. He is a professor and director of Sustaining Urban Places Research Lab at Portland State University and advisor to Kappa Strategies, a global climate consulting firm based in Portland, Oregon. Dr. Shandas studies the effects of urban development and environmental health and social justice, and supports communities in developing contextually relevant solutions to acute effects of climate change. Without further ado, I'm going to go ahead and close out my screen here so that Dr. Shandas can share and speak with you all.
Hi, David. Thank you for the introduction. If you would allow me to share my screen. Oh, there we go. Great. I will open it up. Well, thanks. I will first say I'm in this crowd, I'm not a real doctor. I have a PhD, but I don't practice medicine. And so just want to make sure I am clear that I'm not a health clinician. I spend a lot of time working with healthcare providers and others on aspects related to mental health, physical health, in relation to climate transformation. So I will get into some of that in more detail, but thanks again, David, for the opportunity to present to you. I'm really humbled to be in this group that not only brings their kind of technical and medical training to the communities, but also to kind of couch that in a broader sense of social, a social ethic that is about supporting those often who have the least and who are hit first and worst by many of these climate-induced hazards that we'll talk about, including heat, specifically heat today. I have the good fortune of wearing two hats. As a professor, I'm kind of doing basic research on this field, so I kind of understand, in a sense, what's working, what's not working. As an advisor to a consultancy, I get a sense for how the practice is playing out in and around the country and increasingly the world, where projects are taking me to understand how Rio or Sierra Leone are responding to issues of heat. So again, really grateful for the little time I have. I'll try to be really brief in my words because I know there's some eminent people who are following up immediately after. So I want to just start by a little bit of grounding in context with this work on heat. I've been working in heat for the last 15 years in and around the Pacific Northwest, though also increasingly around the country and world. And part of what I have been scratching my head about is why are people who are lower income, immigrant communities, communities of color consistently experiencing the first and worst effects of heat? There's a whole body of literature that would suggest that those who have greater exposure to heat, meaning without air conditioning, and are in the elements more frequently will be able to tolerate heat. But what we're seeing from the epidemiological evidence is that lower income communities and older adults especially, and those who have pre-existing health conditions and communities of color are often the ones who are facing the brunt of the impacts of heat. And I'm so grateful that this whole field has kind of grown, really taken off in the Pacific Northwest. When I was first doing this, I got laughed out of many rooms saying that there's going to be a 110-degree day and dozens of people are going to die. And I even pointed to exactly where the people were going to die in and around the Pacific, in and around the Portland area. And lo and behold, after June 2021, when that massive heat dome hit, that's where the people who we predicted. It wasn't rocket science, but it was relatively straightforward to identify where folks were going to die. And so this map that you see here, we were able to attribute those specific vulnerabilities and lack of coping capacity to heat to these historic redlining maps. This one of LA, though there's over 200 cities that have been redlined from the federal government in the 1930s during the New Deal era, drew out 4 distinct areas of cities, going from green and blue to, quote, the best and desirable places, to yellow and red being declining and hazardous. And those were places, the green and blue places where lots of federal investments and local investments occurred. Red and yellow places were places that were essentially disinvested. And we see that that long legacy of redlining and segregation still plays out in those who are facing some of the hardest hit heat waves in those same neighborhoods. And we're seeing those temperatures in the yellow and red areas being some of the hottest of any of the 108 cities that we studied across the country. And so this brought to question, like, wow, there's some systemic issues at play here that we really need to get in front of. And how do we contextualize this in the current and historical conditions and think about policies and programs that might help us come up with planning outcomes and goals that directly address heat? One other quick comment I'll make is that heat is not falling into any individual bureau. It doesn't fall into the necessarily the planning bureau, the transportation bureau. It doesn't fall into emergency response per se. It really falls between the cracks. And so it becomes a very challenging prospect to think about management, which I'll get into in a minute. So when I think about this and I step back from the field as a researcher or as a consultant, and I ask myself, what are the big challenges with this heat that's maybe a little different than other climate stressors? One is that thermal conditions are really wildly unpredictable. We've seen this heat dome emerge in June of 2021 in the Pacific Northwest, claiming almost 1,000 lives. And yet we did not ever imagine something like that could happen here. In fact, as I said earlier, I was laughed out of rooms when I suggested as much just a few years earlier. And second, the real health and infrastructure impacts are mounting. We know latest estimate from Dartmouth College in New Hampshire suggested that over a period from mid-90s to now, we've had upwards of $16 trillion in heat-related impacts. While it's not visible through down power lines or down trees or things like a tornado or a hurricane would create, heat is nevertheless a very invisible and silent killer, and very discriminating at that. To add to that, the understanding of risks of how those are distributed and in what scenarios are those risks really amplified, we have very limited evidence on that. We don't really know. We know from sea level rise, we know from wildfires, we even know from flooding where the risks are going to manifest, though an understanding of risks and then which actions would effectively mitigate those risks are largely limited. I'm going to propose to you. And then last 2 bits is inequity is a very strong rhetorical concept throughout award-winning plans like Multnomah County and City of Portland, Oregon's 2015 Climate Action Plan. Yet to actually see how that translates into action, we're still remarkably limited in terms of what we see in terms of investments in equity and trying to move that equity agenda forward. And then finally, this requires considerable coordination across sectors. Often emergency management is the first to the door, getting people into hospitals, getting a response, but yet we don't have a good long-term plan. We have no heat action plans, for example. in the Pacific Northwest, and very few communities around the country have heat action plans at this point. So we really don't know what to do in a short, medium, or long term with this. And that's different than many other of these climate-induced hazards that we can talk about. I want to just break this down into 4 different component parts, and I wish I had more time, but I'm going to be brief on this, and so I can happy to follow up. But to go from risks to resilience, I feel like I need to talk about a natural and built environment, the landscapes that we have some control over, the occupational exposure, which is an area I'm spending increasingly more time in, and understanding the pathways by which people are exposed to extreme hazards like heat, the health and healthcare, including access and coping that communities have, and then well-being and social cohesion as a way to be able to surmount, and make this a little bit more surmountable in terms of a field. So when we take these 4 and I put them into a concept diagram, I come up with something like this, where we have to understand the context background. We have to understand how that hazard is playing out. We have to understand what interventions will work in a specific context. And then we have to know what kind of implementation guidance and direction we need in order to be able to effectively address heat. When you look at just the top 2, context background of, let's say, a place like Ashland, Oregon, or a place like Tacoma, Washington, the context and background and hazards, those are largely what I would characterize as heat risks. So we understand how heat is going to be distributed, who might be right there in the front and center of that heat impact, and then what context they are living in, they're experiencing the world through, and their lived experience of heat. And the second piece is around actions. What actions can we take to really intervene and reduce the likelihood of a very preventable death or illness from heat? So if you follow me so far, I'm going to take you on a little step-by-step process through these 4 large components of natural built environment, occupational exposure, so that we can go from those risks to those actions directly. So we start with the idea of a natural and built environment. We really can take those physical attributes that we have some control over, and we can tie them to ways in which the way we're designing sectors, whether it's education, whether it's outdoor day laborers, whether it's regulations, and even exposure dynamics of how people are getting affected by heat. We can tie those natural and built environment characteristics to potential exposures through looking at the policies and the sectors where people are facing some of these first and worst impacts from heat. Those exposures lead to questions about whether folks have access and availability to healthcare, what they're able to handle emotionally, and what kind of emergency response is going to be present if there is a dire situation where a community member is exposed to extreme heat. That then leads to this whole set of capacities that would allow us to be able to kind of be in community and connected in order to be able to respond to heat. We know that communities that are better connected fare far better than those who are isolated when it comes to natural hazards, and heat is no exception. That social cohesion and well-being can further enable and reduce potential exposure pathways that communities may face in their work or at home or other places where they may be spending time. All of this, in my read of how this plays out, is where we need to be spending a tremendous amount of time, is understanding what risks, monitoring and assessing those risks, and then taking action. I want to present a few examples of how this general conceptual model has played out in some of our work. Here's one example in terms of the natural and built environment, where we essentially took this neighborhood, which is a neighborhood in Northeast Portland, and were able to look at a city that was going to increase housing density here. And the big question that community planners were asking us, can we increase density while maintaining temperatures? So we took this neighborhood, and using a simulation model, an off-the-shelf simulation model, we were able to reorganize this city block from 16 units to 64 units in such a way that we distributed the buildings in different ways. So for example, the gray is the buildings, the green is trees, and black is asphalt. And we configured those differently. This model pushes a lot of hot air, extreme heat through this design. And based on the building configuration, we could actually see that we were able to, in this case, this plan 6S on the far right is the gray bar that actually showed that if we can take several interventions on the physical environment, we could actually reduce temperatures by upwards of 1.75 Celsius on that city block from its already low density level. So we were able to at least conceptually and numerically show that there is a way we can increase density without actually compromising on heat, because we know the more building there is, the greater the heat increases in that neighborhood setting. So that's one example of the built and natural environment. We were wanting to look at occupational exposure, so we set up numerous sensors in the port of Tacoma and various other parts of Tacoma to capture what air quality, particulate matter specifically, and heat, how those two combine to potentially expose workers at the port or nearby to excess levels of pollution and heat. And we were able to create a visualization system that allowed us to go from each week of the entire year and kind of summarize all of the potential time periods in relation to exposure. And this has started to lead to mitigation strategies for being able to reduce potential exposures at specific times or specific weeks of the year, specific times across the year, specific months across the year as well. That's occupational exposure. Our recent study that we just finished with 3 public housing projects in Portland, where we set up indoor air temperature monitors. We're doing this again for a phase 2, working with the Portland Bureau of Emergency Management and Multnomah County Public Health, where we set up indoor air temperature monitors. And we were able to find that there are various different cooling strategies. We did workshops with residents as well as these sensor systems, and we were able to actually learn that even units like in Northwest Tower here that had air conditioning units, we were still seeing temperatures not go below 85, sometimes 90 degree Fahrenheit. This is just one example with the graphs here of a unit that we were looking at and what temperatures did in that unit across July, August, and September. And this is increasingly relevant information. It's remarkable how little information there is to understand exposure pathways of heat. And this was one way we could get at the health and healthcare aspect of who might be experiencing a heightened level of exposure. The final example I just want to run by you as I turn it over after this is the work that we've been doing now for several years, working with community organizations and municipalities to go around and map temperatures, ambient temperatures in and around a region. And we've done this with communities. We do it on bikes, we do it on cars, we do it by walking. And it's a way to bring people together to talk about and socialize what it means to be experiencing hotter summers, what are coping strategies that are effective, not effective. And it's been a remarkable experience to go out and look at this across over now 70 different cities across the country. And now we've also different parts of the world where we've gone out and done this social cohesion process where we actually socialize concepts of heat with folks. So with that, I'll just kind of suggest that there are ways to move this forward. I think one of the big things we need to be thinking about is heat action planning. That is a systematic process by which we look at the evidence, look at that context, look at the hazard, and then really start evaluating where interventions and implementation might occur. There's many examples of these in across the country, and we can start to kind of learn from these and what might be ways we can build something like that for the Pacific Northwest and to tie in, for example, how doctors and hospitals and healthcare practitioners could more directly contribute to a response and kind of a planning process around this. So just closing again with this idea that first we need to get at risks. I think we're woefully inadequate in being able to characterize risks at this point. So we're still collecting a lot of relevant information, and that would really, from the risks, we're really going to be able to drive a lot more actions that are effective rather than kind of trying everything all at once, which will be enormously resource intensive and potentially ineffective in the long run. So we really want to try to figure out what is the problem we're trying to solve before we start getting into kind of actions that we. So with that, I'll just close it out here with the inequities aspect of this and leave it to David to transition us into the next panel speaker. So thanks again. I will switch out here and turn it back to you, David. Thank you.
Yes, thank you so much, Dr. Shandas. I we'll have time for questions at the end of the speaker presentation. So I just ask if you have any questions, feel free to just hold on to them for now. There will be a space for that as well. Just as I shift on over to the presentation. Yes. So our next speaker is Dr. Richard Bruno, MD. He's a family and preventative medicine physician. Richard Bruno is a double-boarded family and preventative medicine physician serving as the senior medical director for primary care at a federally qualified health center focusing on healthcare for the homeless in Portland. His main clinical focus are on HIV, gender-affirming care, obesity, and opioids. He attained a bachelor's from Princeton, a doctorate of medicine from OHSU, and master's from public health from Johns Hopkins Bloomberg School of Public Health, and is a graduate from the Combined Family and Preventative Medicine Residency Program at MedStart, Franklin Square, and Johns Hopkins. Dr. Richard Bruno will be talking a little bit about some of the mental health and wellness impacts of extreme heat, as well as a few initiatives that he has been working on. Without further ado, I will go ahead and turn it over to Dr. Bruno.
Thank you, David. Good afternoon, everyone. So nice to see you all. Thank you for being here. And thanks to Dr. Shandas as well. It's a really amazing work that you're doing. Thank you so much for sharing that. I'm going to talk to you a little bit today about some of the work that I'm working on at Central City Concern, which is a mostly healthcare for the homeless, federally qualified health center here in Portland. And I'll start by just kind of going through, let's see if this works here. I'll start by just saying, I think it's really important to disclose that I don't have any financial affiliations. And I also would like to start with land and labor acknowledgements. I think it's really important to recognize that the buildings that we're on land from the Multnomah, Athmet, Clackamas, Tualatin, Kalapuya, Molalla, bands of the Chinook, and many other tribes who've made their homes along the Columbia River. And I want to recognize the work of the indigenous people in their homelands, because as we're talking about climate change, I think it's really important to recognize that we all have to be good stewards of the land. And also want to recognize yesterday was Juneteenth. And so, the day we celebrated African-American freedom from slavery, 4 million African-Americans were liberated in 1865. And I also want to ensure that we recognize that our country was built on the labor of enslaved people who were kidnapped from the African continent. And I want to recognize and honor their contributions to this land that we now call home. So I also want to just talk about some objectives. We're going to talk a little bit about the medical and psychiatric conditions that put people at higher risk for climate-related events. We're going to talk a little bit about some of the interventions that we can do as a community and what we're doing in healthcare, and then talk about some of the benefits of identifying people who are at high risk and some of those interventions. We'll talk a little bit about through that. First, I want to go very brief, lead you through the timeline of Central City Concern. It's a 40-year-old organization, started in 1979 as basically a medical sobering tank, a place where people could actually just kind of sober up, started doing some acupuncture, started doing some services for people, getting people indoors who are houseless, and eventually started integrating more medical care. We started clinics. We started making sure we had people who could provide multiple services, including medical, mental health, substance use services, included naturopathic medicine, as well as osteopathic and allopathic medicine. And currently, we have 30 residential buildings that have 2,500 units of housing for people in the Portland metro area, including 2 large clinics where we have 30 medical providers. We also have a number of culturally specific programs that I think are really important to note here. Flip the Script, helping people who are returning from jail or prison, formerly incarcerated folks. Fuentes for our Spanish-speaking population in town with Latinx providers. Our Hooper Detox Center is our inpatient center where we provide people with stays and ability to detox inpatient from drugs and alcohol. Karibu and Amani are our culturally specific programs for African-American population in town. Our stabilization and treatment preparation provides mentorship and housing for people returning from incarceration. And our Letting Owing Center is a place where people who are pregnant or have children under 5 can stay in a supportive housing environment with on-site daycare. And so I want to talk a little bit about some of the dangers that exist. And I think Dr. Shandas did a really, really good job of sort of helping us frame what those risks are. So I'll go through this very briefly. I wanted to make sure I included a slide from Dr. Marshall, who is a climate scientist. And I like this kind of cookie analogy because really what we're talking about is like, the ingredients that you put into making a cookie can vary wildly, right? You can kind of change a little bit more baking soda, a little less flour, a little more chocolate chips here or there. And the cookie is actually kind of how it comes together. And then, as you are eating that cookie, that's really the impact that that cookie has on you. So really kind of thinking about what those, the impact overall. So we know that greenhouse gases are all-time high. I won't go through a lot of these, but as we start to see the levels are rising way higher than they ever have been in the history of the Earth. And, you may be familiar with groups like 350.org, which are really highlighting the fact that over 350 parts per million of carbon dioxide in the atmosphere is not safe or sustainable. And, we're currently beyond that. So really trying to mitigate further decline there. I also wanted to recognize that greenhouse gases that are emitted by sector are really, there's a huge industry in healthcare. And so just to recognize that like hospitals, clinics, and the sort of places that I work are a huge contributor to the greenhouse gases. And you can see kind of the left side there with the blue slice there. A lot of these are direct emissions from facilities and vehicles. So all those kind of factors come into, create these climate events. And we know these climate events affect, multiple areas of society. We know that they cause many different problems, including wildfires and heat. We're going to talk mostly about heat today, and then those impacts. And I know Dr. Shandas already mentioned this too, and I think it's really important to note and to harp on a little bit more is that climate disasters are increasing, and the cost is over $1 trillion in the past 7 years, and leading to a lot of internally displaced people. And internally displacement is like a huge contributor to mental health problems too. So we're going to talk about that in a second. But just take a look at this. You have 18 separate billion-dollar weather events in the last year alone. This is 2022. 18 different events that happen across the country that cost $1 billion or more. Whether it was fires, hail, hurricanes, tornadoes, and that number is higher than it's ever been. More frequently, more costly, more deadly. And heat waves are worsening. We're talking about what happened 2 years ago when we had 116 degrees in Oregon, and we recognize that, like, based on the data we've collected from 1895 to 2021, that event that happened is it's like virtually impossible to say that it was related to anything except for to global warming. We really can't attribute it to anything else at this point. And so I think it's really important to note that this data is quite telling. You can see from the graph and the map there. We also have data from cherry blossom trees, right? The spring is happening earlier, and we know that based on data that's been collected since the year 800 AD from Japan, where they tracked the first blossoming of the cherry blossoms every year. And we can see over time, over the last, since 800 to 2016, this happening earlier and earlier. So, we know the spring is happening earlier. This is definitely a great way to visualize how the impact that climate change is having on our weather systems. Okay. And then, so I think it's really important to note that the impacts are astounding. Medical field is a little late to jump on the bandwagon, but they did put out 200 medical journals came together 2 years ago and created a joint statement saying this is the greatest threat to public health is climate change. I think it's really important to recognize that this is happening. I steal this acronym from Dr. Cheryl Holder. She's part of the Florida Clinicians for Climate Action. And it was just a way for me to help kind of remember the different aspects of heat-related and climate change-related events causing human health impact. And that is heat illness, exacerbations of heart and lung disease, asthma, traumatic injury, water and foodborne illness, allergies, vector-borne disease, and emotional distress. And I think what's really interesting is that climate change, it doesn't really cause a lot of new problems, but it certainly makes old problems way worse. And we're going to get into that emotional stress piece in just a moment. And I think this financial impact, $800 billion in health costs each year, just directly related to climate change, I think is really very, very quite telling as well. So next I want to tell you a little bit about the climate action framework we developed at Central City Concern, really trying to take an agency-wide and organization-wide approach to this. We have 1,000 employees within our organization that does mostly healthcare, healthcare and housing and jobs. And so really we are looking at some of these astounding problems. And most of the time, what we're talking about is the impact that these problems have on people of color and low-income folks in low-income communities. And I think, we can really take a look at all of the different aspects that are affected from weather events, food insecurity, economic instability, and pollution. And really, these stressors have a large impact on physical and psychological well-being of folks in these communities, especially folks who are more vulnerable to heat-related illness and death. We talked a little bit about sort of the redlining. Dr. Shandas mentioned sort of, redlining, the way cities are laid out in the urban planning. And you can see that in Portland, neighborhoods are almost 13 degrees hotter than some of the wealthier, whiter, non-redline neighborhoods. We know that Black and African Americans are more likely to suffer from the effects of poor air quality, sometimes 34% more likely to live in areas with higher projected increases in asthma diagnoses. And then we know about the multiple issues related to mental health effects and how there's a pretty well-established connection between higher temperatures and aggression and violence. We're getting into that now. So, we know we're already sort of like underwater in terms of our mental health provider workforce in the state of Oregon. We're already a shortage of 36,000 mental health providers, and that's like qualified mental health professionals, counselors, social workers, and we're hugely behind on that. And so I think as we're facing this looming threat of climate change, we're anticipating that's going to get way worse. The burden on those folks who are already in this industry is going to be harder, and people are going to have larger panels trying to sort of accommodate and provide the kind of care for folks. But we also know that climate change events disrupt the social cohesion, and I think Dr. Shandas really mentioned this earlier in terms of the isolation that happens from when people are isolated due to climate events. And so particularly, vulnerable folks, women, young people, migrants, and people living with disabilities and ethnic minorities. This is a picture of some folks after Hurricane Katrina returning to their home that had been flooded and just kind of standing there like, I don't even know where to start. And that's sometimes how we feel, I think, when we're trying to think about, what do we do in these kinds of situations? This is a little bit of a complicated graph, but I want to go through really quickly because I think it really helps. This is from Nature Climate Change Journal, and it's sort of the causal relationships for mental health effects of drought. So we're going to start with drought here in the left-hand corner. And essentially, drought can cause really disruptions in agricultural production, can increase workloads, cause worse stress, can lead to isolation, and those things can in turn affect people's anxiety, depression, and suicide and violence, unfortunately. So yeah, some pretty big problems. So what are we working on here at Central City is really building a climate action pledge. So we committed to a healthy, equitable climate change future for all of our clients and staff, and pledging to protect environmental resources, reduce greenhouse gases, and decrease vulnerability to the economic and ecological hazards of climate change. And so we took this statement to our board of directors. We just passed it a couple of months ago. And what it means is that we're going to be working on a number of different efforts within our agency and across our agency to include climate action, along with our equity and anti-racism work as well. So that means electrifying our fleet. We have about 30 vehicles that go out into the community, electrifying our buildings. Like I said, we have 30 housing buildings that we own and maintain. And we want to build new buildings with healthy and sustainable materials. We also want to work on the right side of resilience planning and helping people with their own sort of personal resilience, upgrading our infrastructure, protecting against extreme weather, all that leading to the middle here with increased health and safety, more housing stability, and better financial health for our clients that we serve. And we do that through our societal, environmental, competitive advantage, policy, and economic domains here. This is just a sort of couple of quick captions and quotes from some of the folks that live in our housing buildings, talking about the effects of the heat dome in 2021 on housing. One lady said that she had some neighbors that died during the heat waves, and how much of an impact that had on her specifically. One fellow is worried about the violence as the heat increases and people get more desperate, said it's made him more anxious. And then, of course, power outages and extreme weather can create safety concerns for people that work outside. This is a woman who works as part of our Clean Start program, goes around to various parts of town to help do cleaning after campsites. There's a whole graffiti removal team that goes around. You may have seen the Central City Concern trucks going around cleaning up campsites. And so I think that's really part of the impetus to really want to change things on a system level, especially for our organization. So improving our facilities, the fleet, the fuels that we're using, and developing and maintaining that framework, like I said. So all the new buildings that we build have solar panels on top. We're retrofitting some of our old buildings with solar panels as well. And then we've been collaborating with Health Share Oregon, which is the Oregon Health Plan, one of the main payers in the state of Oregon that pays for most of the Medicaid and a lot of the Medicare patients in the state of Oregon. And HealthShare has developed this climate dashboard to help identify people who are at high risk of climate change events. And so they divide it up into tier 1 and tier 2 conditions. And that, tier 1 would be people who may be experiencing houselessness, someone who has heart failure, renal disease, someone who's pregnant, someone who may have SPMI, severe persistent mental illness. And so I want to talk a little bit more about the mental illness part of this, because I think it's really important to identify folks who are already struggling with mental health in order to provide resources and interventions to help folks mitigate and weather those changes. So we're in the process of utilizing this database, which will tell us all of our patients. We have about 13,000 patients that we see a year, and we'll be able to identify which of those patients include these higher risk folks so that we can do some interventions targeted toward helping them. Also want to give a quick nod to the Portland Heat Vulnerability Index. This is a way to track who in certain areas is most vulnerable. And Dr. Shandas, you're already probably familiar with this. I don't know if you use that or you have been doing work with this group or not, but I think this is a really important way to sort of conceptualize and frame the city in terms of how vulnerable are folks in certain areas of town, and how we start to intervene and provide community level interventions. So I just really quickly will tell you a little bit about work we did back in 2 years ago when we had that really hot summer. We worked with our housing buildings to identify those folks who are at highest risk, and we got a state level grant to buy air conditioning units, these portable air conditioning units to install. And so we started putting those into our housing buildings so people could have cooler air coming in and help prevent them from getting heat exhaustion and heat stroke, as well as all the other conditions we mentioned before. And so I'll save the Q&A part for later, and here's some references. And you can see these slides anytime if you just go to that tiny.cc/extreme heat link there. And happy to turn it back over to David for the rest of the session. Thank you so very much.
Thank you, Dr. Bruno. Um, yes, and our third speaker for today is Alessandra de la Torre, who is, sorry, one second. Here I thought I was sharing my screen. um, Apologies. Our third and final speaker for today is Alessandra de la Torre, who is the Advocacy and Programs Director at Rogue Climate, an organization whose mission is to empower Southern Oregon Oregoners who are most impacted by climate change to win climate justice. Alessandra leads Rogue Climate's work transforming energy systems to benefit communities most impacted by climate change. She was born and raised in the Bay Area, California, where she first became concerned with the intersection of the environment, public health, and racism. Alessandra graduated from Southern Oregon University with a Bachelor of Science in Sociology and previously organized a food insecurity campaign in Southern Oregon University and later worked as a community organizer focusing on immigration justice at the Rogue Valley chapter of Unite Oregon. Alessandra serves as a member of the Seeding Justice Foundation and the Southern Oregon Latino Partnership Program. It is my distinct honor to welcome Alessandra La Torre, who will be speaking about some of the work that environmental justice organizations have been leading in the area of disaster resilience. With that, I will stop and turn it over to Alessandra.
Yeah, thank you, David. I know we have the same last name, so I consider you a cousin. If you could give me screen sharing, that would be great. But thank you, everyone. I was invited here specifically because of both Rogue Climate, the organization I work for, as well as a coalition that's working on possibly passing a Resilience Hub grant program here in the state of Oregon. And so we're actually waiting for a House floor vote currently right now. So if I like scream and halfway through this, it's probably a good sign that it's going to move to the Senate. So yeah, so let me share my screen. Okay, and I hope folks could see that well. But like I said, I work with Rogue Climate, and Rogue Climate has offices down here in Phoenix, Oregon, as well as in Coos Bay. And we work in climate justice, so really prioritizing those that are affected first and worst by climate change. And it started in 2013. The organization helped do a salmon project where people across the Rogue Valley were able to create these like scales for the salmon. And it was to bring awareness to climate action as well as to the salmon being threatened here in Southern Oregon and beyond. And we were specifically focusing on the Jordan Cove LNG, which this pipeline was threatening different waterways in our different rivers in Southern Oregon and Northern California, and then all the way to the Coos Bay estuary. And so it was 2 decades of fighting. And these were folks who were landowners, who were indigenous communities, who were youth, it really fishing communities. It really spanned through, and a reason that I am also thinking about community connections, which Dr. Shandas also brought up and made me excited, was because it really is about how we show up for one another. And so with this campaign and establishing Rogue Climate, we were able to continue to do climate justice work. And so we've been now, it's been 10 years. And here are just some photos of some of the things we do. So we do policy work in the legislature, mostly around engaging community members in those engagement opportunities. And also bringing some art into the mix, bringing in, sometimes we do some free Zumba for the community. We've gone up to Salem to lobby, and so teaching about like lobby trainings, things like that. And all of this, again, to really touch on how we make progress together as a community and being able to have voices heard in decision-making spaces. And so we were able to actually pass 3 energy justice bills in the year of 2021. And those bills were connected to energy affordability, as well as folks being able to have home repairs. We've also worked on energy efficiency. And so all of these touching on the fact that energy burden is very real in our communities. And when you connect that to extreme heat, people go, sometimes will use dangerous methods of heating their homes, will not turn on AC or vice versa because they can't afford it. And so being able to reduce that energy burden is kind of a way that we also see folks being able to safely be able to cool their homes, as well as energy efficiency programs, having more access and less barriers for those programs. And so we've done free ductless heat pump programs in collaboration with like Energy Trust of Oregon or Oregon Department of Energy, free to low cost ductless heat pumps, and specifically targeting low income communities to have access to those heating and cooling systems. And as some folks know, in Southern Oregon, specifically affecting Ashland, Phoenix, and Talent, in September 8th of 2020, the Alameda fire burned through our towns. And this really caused for an immediate reaction from local people, from community members here, from organizations, who we were able to set up mutual aid sites. We were able to coordinate hundreds of volunteers. Transportation was really important, both for transporting supplies and also people, especially people who don't have transportation. Storage, emergency housing, which ended up being a lot of hotels, or there are these like pods right here. And also emergency funds. So we were able to create the Rogue Valley Relief Fund that was very low barrier ways to be able to get funding out. So being able to get gift cards out to folks, gas cards, grocery store cards, things that were able to help just in the immediate aftermath. Communicating information was a really tough thing. A lot of people weren't sure what was happening the first couple days, and so there was a lot of confusion. So being able to try to inform as much as possible, resource navigation, and then when we're talking about extreme heat, it was really hot during those days, and there was a lot of smoke as well, and COVID was still very much alive and everywhere. So there was a lot of compounding factors that we had to deal with and try to, prioritize what we could do to give the most relief to folks and families. And so that's something that that when we think about extreme heat, also thinking about smoke, also thinking about wildfire, and just like how do we navigate through these kind of compounding issues and disasters that happen. There's also a lot of collaborations happening really immediately, just like, who could do what, who could take things where. And these were churches, restaurants, parking lots, schools, nonprofits, ranches, and just really just people who cared and wanted to help. Folks who were helping were sometimes also fire survivors, and they, it was able to provide not only like a distraction, but also a sense of sharing and kind of going through things together. And that connection has lasted till this day. And so these same places, churches, schools, nonprofits, are also some of the top places that people would feel comfortable seeing resilience hubs, and have also been hubs that we've seen other states doing. So it is, as we kind of go into thinking about resilience hubs, we were actually naturally kind of seeing them when we were reacting to the Almeda fire. And recovery is still happening almost 3 years later. But here are just some of the things that are still very much relevant. So resource navigation, being able to have that one-on-one assistance, it is really crucial for sometimes having a successful enrollment in a program or having relief in some way. And also being able to have that in your preferred language. So unfortunately, a lot of the time, some applications aren't in other languages other than English or sometimes even Spanish. And so there's a lot of barriers that go into folks being able to access resources. And of course, it's always those that are most vulnerable who have the most barriers to access these resources. There's also in recovery a lot of housing assistance and ownership. Through the Rogue Valley Relief Fund, we were able to help people pay for security deposit and first month's rent. We were also able to help pay for parts of like down payments for home ownership. And this was all, again, just organizations coming together and being able to fundraise to have a more low barrier and accessible way to get funds and to bring some relief. There's also been the Talent Phoenix School District actually just got approved for a grant for solar and battery backup in their schools, almost like a mini microgrid. And they also have a community care program that specifically does resource navigation. And so, and that grant that they were able to receive to fund a big portion of their project was actually one of the bills that we helped pass in 2021 on energy justice. And so it's really cool to be able to see kind of that full circle of, getting people together to help pass this law and then be able to see the benefits come in to our communities now. And speaking about mental health, there was a lot of lack of bilingual services for mental health. And also, when you think about cultural competency and diversity, mental health and people talking about things that have happened, there's a lot of like taboo feelings around getting therapy. And then especially if there's not someone who maybe you could share your culture with or your language with, that really sets up a lot of barriers for folks. So these are just some of the things that we started to find that were positive, negatives, things like that during this like recovery phase that really has now become our everyday. And yeah, we were able to continue to do supply kind of pop-ups around talent in Phoenix, including the FEMA trailer neighborhoods that popped up. And also we saw new emerging organizations as well to help fill in some of the gaps, including some free farmers markets that are now alive and well and are really awesome that Rogue Food Unites puts on. So getting more now into the Resilience Hub and what those are, we again really started to, after the Almeda fire, want to learn more about resilience hubs, and we're able to learn from places in Florida, New Orleans, in Hawaii, in Puerto Rico that have already experienced natural disasters for a long time and have already been setting up these types of hubs. And so for Rogue Climate, a resilience hub was a place or group that has established relationships in the community that utilizes their resources and our physical infrastructure to create safe places dedicated to resilience, however the community sees fit. And that's really key because it really is about listening to community and what fits better in that local area. And so being able to have a trusted place, being able to have that place be familiar, and then also equipped with infrastructure to activate during disruptions is really at the core of resilience hubs. So here are some just kind of 5 foundations that we found for successful resilience hubs. It first started with equity and listening. And so that means having community conversations, that means surveys, to be able to really hone in and garner what the community would really need and also want in these resilience hubs. Some of the things that we've already heard are childcare or different family activities, resources for children with disabilities, folks who have gone through natural disasters and have kids with disabilities. It's really hard for them to find a good fit, especially if you're just going to a shelter that just has tables and chairs and that's like what you get, or maybe like a little cot or something, they found that was something that they would really enjoy if there was a place where there was more resources for people with disabilities, especially children. And also a place for joy, for watching a movie maybe, or like maybe there's a community garden and things that are able to, again, feel like the resilience part, right? You're not just surviving, but you're also thriving as well as you can in the midst of any type of disruption. So being able to have joy, and then mental health as well. So these are things that you get to hear from folks as you go through kind of that process of being able to listen. Then we also have overall well-being outside of disaster scenarios, right? So that goes again into, if these are trusted places and familiar places, these are places that don't just exist when there's a disaster, right? These are places that you are, that where it is, right? And so if something happens, you know where to go, and being able to be outside of that like traditional way that we think of emergency infrastructure, such as cooling shelters and things like that, to make it more family friendly. And then for the third one, reliable energy sources. So again, communication is really key during disruptions, during power outages, things like that, being able to have access to Wi-Fi, or power, right? Refrigeration, if you have medication, things like that. And I think when we're talking about also for heat, being able to have a place that could be cool. And again, not just tables and chairs, but actual activities for folks, actual, things that could sometimes take your mind off of it, right? How are we taking care of ourselves? And even when there's stressors around, and decreasing that feeling of like victimization, or like, oh, I don't have cooling in my house, or things like that, where it's enjoyable to go to this place. And then fourth, partnerships and collaboration. And so thinking about not, these hubs don't have to do everything in one place, right? And so especially when we think about rural areas, or think about just like the type of things that we would need to really feel prepared and really feel like we could show up for one another, both on the everyday and during disruptions, is being able to partner together, right? And so, for instance, with the Talent and Phoenix School District, with their little, or I guess not too little, but their microgrid kind of project that they're going to start constructing. And they already have a community care program that does resource navigation, but what they really don't have is storage. And they also don't have like drinking water, and storage for drinking water. And so being able to have collaborations and partnership with churches who do have big storage, and with Access, who has provided drinking water before during disruptions, and being able to kind of map out how as a network we could fit together for community resilience as a whole. And this is just some of the findings at Rural Climate. We had a survey in 2021, and these were some of the important resources that community members were saying that they would like to see in a resilience hub. And so I won't go through all of them, but heating and cooling definitely was one of them, as well as clean air, refrigeration, and mental health resources as well. Cool. And there is, I actually don't know if the sound is gonna go through, so I might not play the video, but this is a video from Puerto Rico, one of their resilience hubs. And so, I mean, I could see if I could play it, and then or let me stop sharing my screen, and then I'll share with sound. I think that would be best.
Hi, my name is Alfredo Perez, Infrastructure and DRR Project Officer here in Puerto Rico, and today we're going to show you our Resilience Hub model and their importance in emergency scenarios. We are in Asociación Pro Juventud, one of our 17 Resilience Hubs around the archipelago, and I'm going to explain the 5 areas that compose a Resilience Hub. The first is the community gardens, then goes to connectivity via sat phones and internet, disaster risk reduction via equipment and workshops, off-grid solar energy, and potable water. Here we have the community gardens. Everything that is harvested from here is used either in the kitchen or distributed between volunteers of the Resilience Hub. In the DRR workshops, we help them build plans to prepare for emergency scenarios and for water and food distributions. In my back, we can see the potable water storage systems. These systems use water from the National Aqueduct Company, but we take the liberty to filtrate it a couple times more. This way, we make sure that the water to be distributed is indeed potable. Here we have the energy storage systems. In case of a power outage, they will always have power to serve their community and continue their normal operation. Here we have the internet system with its battery backup. In case of an emergency, the community can come to this Resilient Hub and let their relatives know they're doing okay or any help they might need. Here, we are in one of the many rooms used to storage non-food items. Year-long, they are distributing these with their community. Thank you for visiting Asociación Pro Juventud with me today. This center is just one of Mercy Corps' 17 Resilience Hubs across Puerto Rico, all of which are helping vulnerable communities better prepare for disasters and meet their urgent needs when crisis does strike. Hi, my name.
All right. Thanks, y'all, for watching that. For me, as a visual learner, it always helps to have a video or something that also explains a concept.
Yeah.
Cool. So as I finish up here, some of the goals of Resilience Hubs are to uplift the pre-existing strengths and assets in our community, to create and foster self-sufficient communities, cultivate a culture of preparedness and accountability, build on pre-existing and elaborate support systems, and establish and enrich effective communication streams. So as I mentioned, we are currently advocating for HB 2990, which is now in the climate budget package as HB 3409. And this is with a coalition with the Oregon Just Transition Alliance, with Unite Oregon, with Adelante Mujeres, just so many coalitions across Oregon coming together to ask for there to be funding for these types of hubs and networks. And so if it passes, it will be a grant program through the Office of Resilience and Emergency Management that will directly go to communities to build and implement community hubs and networks. And I could put a link where you could find some of that information as well. And just wanted to leave y'all with this quote. If we're not thinking about everyday quality of life for people in general, then we're missing out on what it means to actually be resilient, by Kristen Baja from Urban Sustainability Directors Network. And that is all. Thanks y'all so much.
Thank you so much. Yes, with that, I mean, we've heard from all 3 of our speakers, a whole just breadth and depth of knowledge here. And with that, I'm just going to go ahead and shift into our next part of our presentation, which, as I mentioned, as promised, there's a Q&A part to the presentation. We do have 10 minutes allocated to questions, if there are any, but just wanted to say thank you. A huge round of applause to the speakers for coming here today and talking about their expertise and the work and advocacy that they've been doing in the community and in their spaces. So yeah, absolutely. Thank you all for coming today and speaking about these important issues. Something that just came to mind for me too, as I was listening to the presentation, was just the, as Dr. Bruno mentioned, that climate change disrupts cohesion, and there's an isolation that results also as a result of that. And just thinking also along the lines of the climate resilience hubs and how that, that social and community support also, that being sort of that cohesion also, or sort of a response or a mechanism or a tool, or that can be, or a space really that can be there for communities to support health. Because as we know, social and community support is actually a social determinant of health. And when people are supported, their health and wellness is also supported. So that's a very interesting connection, as well as the importance of having no heat action or heat action plans, which is also something that I've learned here today, thanks to Dr. Vivek Shandas. Yeah, I definitely will go ahead and open it up to our speakers. If there are any questions from the audience, feel free to raise your hand using the raise hand function on the chat, and then we can go in order of whichever one questions are closest to our screen, in that particular order. So I'm gonna just stop sharing here just so I can see. It looks like there is one question from Christy Munoz, who's the first person on my screen.
Thanks, David. Can you hear me okay? Awesome. Yeah, this question is for any of the speakers, but something that Dr. Shandas mentioned earlier that really rang true for the organization I work with, which is a United Way here in the Multnomah County area, is that heat does not fit in any one bureau or government entity. And that really has been a challenge that our United Way has had in regards to bridging community-based organizations like Rogue Climate in our region to further communicate with government entities. So communication, preparedness, and outreach has been a really big challenge. Currently, Oregon, our state, is a free-for-all in regarding to preparedness. So that means that every county creates their own plans and outreach materials. So there is no drumbeat around what messaging resonates for all. So my curiosity is for the speakers is, how can we achieve statewide equitable and linguistically appropriate disaster messaging for our communities across the full state? Because at the end of the day, preparedness and communication is prevention, and prevention is public health equity. Thank you all.
Thank you. And is there a speaker who would like to respond to this question first?
I might, maybe, Christy, hi, this is Vivek. I might quickly just respond by saying I totally get the challenges with communication. On a broader level, the only communication around heat that I actually see is from emergency management that goes out right when the National Weather Service declares a heat advisory. And that's kind of the major communication. And they do everything from texting to emails to broadcasts on radio, etc. But more systematic communication across multiple bureaus, I don't think such a mechanism right now exists. We've tried to kind of skirt around that. In 2022, we did what's called a heat week. We had a website, it expired, but it's called heatweek.org. And we're holding a lot of resources on that to be able to get municipal managers, decision makers, just the public and community-based organizations to come together to essentially honor those who died during the 2021 heat dome, though also to recognize that we really need to do a lot more systematic integration of communication channels across bureaus, and especially out to kind of community-based organizations and their kind of champions, their leaders in many ways, so that their constituents can receive the info. At this point, if somebody is able to start a program that's like heatcommunications.org or some, I don't know what it would be, but some way of getting the word out, I think there'd be a lot of receptivity to it pretty quickly, is my general sense of where we are with that.
Yeah, this is Alessandra. I was just gonna add, I have the same question, Christy. I would also want to see where that happens. I mostly see it pop up randomly in, for instance, with the OSHA rules for heat and smoke for specifically for workers, right? But it's like very targeted specifically for workers who work outside during heat and smoke. And so being able to have that like agency or something that is specifically focused on it, I would love to see that. And I know the Office of Resilience and Emergency Management is fairly new, and they are just an agency that might be able to take on more. But I think, yeah, I think when it comes to heat, I also kind of question where that preparedness is coming from and who's taking the lead on that type of direction, and then being able to open it up to stakeholders and community members to actually give feedback so that it could be something that's accessible and that actually has an equity lens and culturally competent lens to it.
Thank you. Other thoughts on this issue? Great. The next question is from Theodora Songas, who is has her hand up. Theodora.
Hi, it's just a small question, but when you're planning for resilience hubs, how do you figure out how many you're going to need for how many people, or the size, or how far you have to walk to get to it, and so forth, if you have to carry water back to your house? Or, I mean, how do you work out the numbers in planning for these?
Yeah, thank you. That's a really good question. And I personally haven't been in the weeds yet of actually planning and establishing, but we were able to create a guidebook for groups to start and having those conversations, because things like walkability is one of the things that you want to make sure that a hub has. So I will put that guidebook in the chat for folks to be able to check out, and it comes with also like worksheets to be able to foster conversation of like, what are the assets we already have, what are the things that we want to have, what are long term, if we could get all the funding in the world, what is the vision? So being able to kind of have those conversations with the groups. Because one thing that is important is not feeling like you have to do everything in one place, right? And seeing, leveraging what people already bring to the table, and then seeing what are the gaps that then we want to come together to help happen, right? So for instance, with the schools, the talent schools, they have so many things that would check off like, yeah, you're basically a resilience hub, but when it comes to storage and supplies and having access to drinking water, they don't have, which is where the conversations of collaboration come in from different partners. But they have the heating and cooling, they have the smoke air filtration systems, right? They have friendly, familiar faces, teachers, child activities, mental health professionals, right? So being able to have the conversations of what is still needed, and what could we feasibly do, and then in the future, what would we want to be able to build up? So I hope this link in the chat works for folks. Thank you.
Yeah, thank you. There is another question in the audience too by Beth Poteet.
Yeah, thank you. Hi, everybody. I work for Multnomah County in public health and love the presentation. This question is a little bit directed probably more towards Alessandra and Dr. Bruno, but Vivek also chime in too, please. So I'm thinking about the mental health impacts, and Dr. Bruno, you mentioned, we're 36,000 mental health professionals short already in the state. And I'm thinking about, how do we support community health workers and peers and other kind of lay mental health professionals who can help support communities, and both in the prevention side, but I'm curious too, Alessandra, like your experience like after the disaster, and what are some of those, what's the work that's happening around social you know, pushing back against social isolation and the mental health impacts. So anyone can answer, but I'm curious about that.
Yeah, thank you, Beth. And I will say immediately after the fires, that's when the most kind of help happened, and then it starts to dwindle as the months go on, right? And mental health was definitely one of those as well. There was a lot of like kind of group therapy or group conversations to be able to, you know, help. But what sometimes happens too is sometimes people aren't ready for that immediately after, right? And so there's been quite a few families that now, almost 3 years later, have now reached out and been like, hey, I really think I need to talk to somebody, right? And so how do we have that same, oh, it's free and it's like, you know, you could get it right now in the long term for folks as well. And so I would say that as one. Again, being able to have also that mental health support in your language is really important. And so, and that could also be covered by things like OHP and stuff like that. But Raíces de Bienestar, they are specifically, you know, in the Portland area, but they have been able to offer a lot of services to fire survivors who are Spanish speaking. And I think the only barrier there is that they're not here. And so Zoom could be difficult for folks to navigate. Phone calls are usually okay as well. And so I think that's just a gap that we see, right? That not necessarily is not going to get filled in today or tomorrow, but that it is a gap to be able to feel comfortable. And then also mental health services for kids. That was also a big thing that came up, was like, my child is 8 and saw the fire in his backyard. And I know that they're going through something, but I don't know exactly what to do about it. And so being able to specifically have resources for kids as well who have gone through disasters. Yeah, I hope that helps.
Yeah, great calls, all of those, Alessandra. One thing we're working on, Beth, is just workforce development, sort of pipeline building within our agency. So Central City Concern has a lot of opportunities for learners to come in, like through structured like institutions, like social worker programs and CADC programs for certified alcohol drug counselors. But also we have a number of sort of job training, on the job training for like peer recovery specialists and other folks who are kind of peer level, trying to ensure that we are getting folks who are well, so like 38% of our entire workforce at Central City Concern are former clients, you know, a lot of them in active recovery. So we try to provide that sort of on-the-job training too for folks who want to move into that space and help others. So I think that's, you know, just like kind of a stopgap, you know, in the moment as we're trying to like, you know, build more funding around on the federal and state level around, you know, opening up those training programs and getting more folks trained to do that important mental health work.
Yeah, thank you all so much for this incredible discussion and also just a space to talk about these issues related to disaster resilience. It's 5:27, so with that, I'm gonna start closing us out for the session. But I do want to encourage you all to just take some time. It could be now or after, if you do have time. We do have just a very quick Jamboard activity between now and 5:27. But even like afterwards, you can fill it out. But the big question is, what does resilience means to you within the context of extreme heat? So I just want to put that out there. If you want to contribute, it could be a mural that we create together and form a framework that we use as we move forward with some of these sessions. It's the questions that we're going to just keep asking some of the folks in the audience and continue to learn and grow together. But again, thank you all for your time and for joining today on a Tuesday afternoon. And again, a huge round of applause to all of the speakers, Dr. Vivek Shandas, Dr. Richard Bruno, and as well as Alessandra de la Torre, who have all given us a lot to think about in the fields of disaster resilience and health.
Thank you, David. Thank you, Anna. Appreciate everybody.
Thanks, everyone.
Take care.
Yeah, have a good day.
We'll be sending out the recording as well.